All right, so I am here with Tyler. He is one of our best IV starters. He used to be a tech here, went to nursing school, now he's a full-blown RN. And we're gonna do starting an IV video. I did one a few years back and it was good, but this was gonna be better. Hello and welcome to another episode of DrER.TV. Please don't forget to subscribe and hit that bell notification so you don't miss any videos. We're going to discuss sites, indications, contraindications, consideration for difficult veins, and maybe we're going to do an easier IV, then we're going to do a harder IV. So Tyler, talk to us.
So really the first thing you want to do when you go in a room is your hand hygiene, wash your hands, put some gloves on. But you also need to make sure you know what you need this IV for. If you're doing an angio screen, if you're looking for a PE, if you're doing a contrast scan, you need a certain size. If you're transfusing blood, and if the medicine's a vesicant, you want to make sure that you've got some kind of central access and that you don't need to do the peripheral line. Everyone's skin is different, so a lot of this is you getting in there and doing it and getting a feel for different skin turgors, and we'll get started from here, I guess. So the first thing I always do when I go in a room is I'll go ahead, before I get all my equipment set up, got my gloves on, and I will just go ahead and put the tourniquet on and let that kind of sit while I set up the rest of my equipment.
These are some ready-made kits that have a swab, the tourniquet, the tegaderm, little tape, a gauze, pretty much everything you need to get the IV started.
J-loop, pigtail, some people call it, saline flush, and then whatever IV catheter size you'll need, and they're usually color-coded. Blue is 22, pink is 20. As the numbers get smaller, the gauge, it actually gets bigger, so that can be misleading for a lot of people.
So what we're just saying, if we're thinking this patient needs a CT study, where they're going to have to do
a minimum of a 20 gauge, and you want to get it as close to the heart as possible. So you want to try to get it at least in the antecubital and the bend of the arm or higher. That's going to give you the best, clearest study for those scans. Let's see. We'll go ahead, put your tourniquet on. Now when you do this, you want to be able to quick release it later. So wrap, and you'll kind of tuck this one under, so that you just have a little pull tab. So when you're ready to release it, it just takes a little pull. So, and if you're having a hard time finding a vein, crank that tourniquet on. Don't be afraid to, because it really helps bring up those veins and help them pop. And some people will say that it does hurt, but an IV isn't a painless procedure. Unfortunately, I wish there was a better way to give medicine. And
like when you go to donate blood and stuff, you have the patient that can do some contractions. You know, that increases the flow. And because you got the tourniquet, it's going to stop the backflow. So you're just doing that a few times. Might pop that vein. A couple things the nurses do to pop them out. What is it?
We'll flick it a little bit, and it kind of irritates the skin around the area, and it kind of engorges that vessel as well. He's got such a good vein here, don't really need to do much with it. Now, these ACs usually stick out, the antecubitals usually stick out pretty well for people. The problem with that is when he bends his arm, it's going to kink that catheter, and it's going to stop the flow of the medication. They are flexible catheters. It's not really going to do any damage inside the vessel, but it can prevent medication administration.
And then the IVs run real slow because the patient falls asleep and puts their arm like this, and it's bent. And then you come back and there's not even 100 cc of the bags going in. The other thing is, if there's really tiny vessels, you can put some nitro paste right over it, but then you can get some systemic absorption, which can drop the pressure and stuff, but that can dilate that vessel, make it more visible.
We have a couple of other tools here that sometimes we use for people if we're having a hard time finding good access. This is called our vein finder. It works pretty well. It doesn't go very deep under the surface of the skin, maybe a couple of millimeters, but it shoots an infrared light and it shows you where the vasculature is under the skin, and you can actually reverse the colors and make the veins red and the skin around it.
Now, of course, that shows you just the color where it's at, but it doesn't tell you the depth or if it's thickness.
And even if you can see the vein, doesn't necessarily mean it's going to be good for an IV. You need to be able to feel it too, because it needs to be open. That lumen can't be flat, because sometimes they're flat up against the surface of the skin, and you're not going to get a needle in the middle of that vein. So you also have to assess how well can you feel it.
It's like looking at a river from a plane. It could be a really, really wide river, but be a one foot deep. Versus you can see a 10-foot river wide, but be 10 foot deep. So when you see a vessel with that color, you know the vessel's there, but you don't know how deep or how thick that vessel is.
So, and then when it comes to getting access on a larger vein that's a little deeper, that won't show up with this vein finder here, you have the ultrasound machine. This does take some specialized learning, and it is a little cumbersome when you get used to it, because you have to hold that probe and a needle and try to hold traction on their skin as you're inserting that needle. So it takes a lot of getting used to use this machine effectively.
Should we release my tourniquet before I get some blood clots and
yeah, never forget to release your tourniquet after you start an IV. Yeah. I've seen it happen before. All right.
I'm gonna change that.
Here is a pretty standard ultrasound machine. You don't need a lot of jelly on this, just enough to make sure that there's no air in between the probe and the patient's skin. A lot of people will goop this jelly on.
Now, is ultrasound a standard nursing skill now, or is it that you took something extra?
No, I also have started doing PICC lines as well. So I've been getting training on this. You have to be signed off here at our hospital to use this ultrasound.
I'm going to change the probe.
Change the probe color. So sometimes you got to mess with the settings a little bit, change the contrast on.
And this is a very lighted room, so it doesn't help with the ultrasound. But the other thing is,
so if you can see right up top here, there's a little opening. It looks like a little mouth, and if you press on that, it'll close as you put pressure. That's your vein up top here. It's hard to see the scale.
Just depth. Do a little extra. Do it again. Bam.
So there's your vein right there at the top. You want a light touch, because any pressure is going to collapse that vein. And then if you're looking for your artery, you kind of have to put a little pressure down, but you'll start to see it pulsate. And that's how you know it's an artery under there and not a vein, and to stay away from that.
Cool. All right, let's do it.
All right.
Get the blood.
I'm going to clean your arm off.
And I donate blood every time I can, so I'm used to getting poked there.
All right, so tourniquet first. Have them straighten out and kind of lay it down. You want gravity to be your friend. So always use every advantage you can. Gravity will help cool that vein and engorge it. And this is just a chlorhexidine and alcohol mixture. You just kind of want to scrub the area pretty good. And so you'll notice, even on him, as you pull his skin, you can just kind of touch it and you can kind of see how his skin moves on top. So before you stick anybody, you always want to hold traction. And different people's skin turgor is going to make you have to hold it differently for each person. Some people you have to hold better and tighter and from multiple angles. I always will get at least 3 points of contact when I am sticking. So before I go in, I'll spread above, side to side here with these two. And with these two fingers here, I kind of pull back so that when I stick the skin, it doesn't drag the skin and move my insertion point. So stretch, stretch, pull. And you want a low angle if it's towards the surface, about maybe 20 to 30 degrees. And 1, 2, 3, poke. So you got your flash, you're in, lower your angle, and thread your catheter. Pull back the needle, and it'll click. I'm not drawing blood, so I'm gonna pop my tourniquet. It release some of that pressure. It won't bleed as much on me. Little kit comes with a 2x2 gauze pad. Just place it right up under there. And some people will pre-flush these J-loops with saline so that they don't have an air embolism going in. I always will leave them empty, pull back the blood through the J-loop into my saline flush. That's kind of gives me extra verification that I'm in that vein, and then I'll flush it after that. Because you can get a flash here and have gone through the vein and think that you're in it, and it can be misleading at times. So just a little pressure here with your side of your finger. Don't be afraid to push a little hard because you want to occlude that, and this just comes right off. A little bleeding is pretty common there.
But look how clean, you know, he had the gauze there, ready for that little bit of blood. And it's just a clean IV.
Tegaderm on top. And some people will have a reaction with the chlorhexidine and the Tegaderm. If you don't let the chlorhexidine dry all the way, they'll get a little bit of a reaction on their skin and get a little rash. Kind of burns some people. So make sure that chlorhexidine is dry. So pull back a little bit. Got my good blood return.
The air out.
Got the air out of the line, and then a slow flush. I don't have any resistance, so I'm comfortable with this IV. Always clamp it so that you don't get any blood into the end of the catheter tip, because that can cause a clot at the end of that catheter tip. So always clamp it so you don't get that backflow. And a little piece of tape just to secure that J-loop on top. And that's it.
And that's antecubital IV. Beautiful, beautiful. Now that's the easy one. I have a big vein and it's easy to go in. So then we're gonna challenge and try to do one of the smaller ones.
So good places to look for IVs. Obviously the bend of the arm. A lot of people will have one on the top of their wrist right here. But I'll tell you, the closer you get to the tip of the fingertips and the pads of your fingers, so as you work your way down the arm and the hand, you've got more nerve endings down here. It's gonna be a lot more sensitive in the hand and on the wrist than it is up closer to the upper arm. A lot of people stick from the forearm down, and they forget to look that a lot of people have a very large cephalic vein right on top of their bicep. And most people who are younger and healthier will have a good large vein here. And I can see his outline there. It's good green color. I'm trying to think. People will also have veins right up here on the shoulder a lot of times, and they're missed or overlooked because people don't look that high. You don't want to get into the chest though, because those veins can be going either way. So you're not sure which way those veins are going. So you always want to make sure that you're going with the flow of blood with your IV. So you want to try one on your wrist here or back of your hand. Take this watch off here. All right, let's see what he's got. So, a lot of people have veins here that you can visualize, but I will tell you right now, it's a very tender area.
We're just gonna pretend that this is an old lady and that's the only veins we see. So we're gonna really challenge, because those are probably 5 times smaller than the one he was on. And that's just to gross visualization. When you consider the area of a diameter of a circle, it's 10 times or more smaller than the other one.
I'm doing okay.
I'm fine.
Okay.
And if you ever have to go to something like even more than that, like the neck, usually you have to get the doctor. Sometimes we have paramedics in the ER that they can are credentialed to do it. Some nurses are credentialed to do it as well, but usually under direct consult with the physician or direct presence of the ER doctor there. A lot of times I'll start them, but I'll let them finish just because they're so much better at it. So I'll hit the vessel and then hand it off for they to finish up.
All right. So let's see. Sometimes rubbing it a little alcohol on it helps really show those veins up. And if you've got someone who's got a darker skin color and you're having a hard time visualizing any of their veins, you can grab a little betadine and rub it on their skin, and it'll illuminate kind of their veins at a greenish color, and you can see it a lot better.
That I didn't know.
I learned that trick from a paramedic at one point.
So you can see on that one, so much more sensitive to that traction. I mean, he's literally moving that vein.
You can stretch it and straighten it out as well.
And you can collapse it if you press too much.
Mm-hmm. Not very long, because you don't want to start it here, because you'll see this bifurcation where the vein kind of splits off, and typically there's a valve there of some sort, and it's usually hard to thread the catheter past these little bifurcations. So if you run into a vein and it feels okay, and then you feel it kind of joins up or splits off with another vein, you want to try to avoid sticking in that area because it may not thread correctly. So I think I might need a shorter IV catheter, so I'll get a 24. So our 24 gauge catheters are a little bit shorter than the 22s and the 20s. So it gives me a little bit more wiggle room. So again, you can kind of flick it, get that vein angry. All right, let's get the wrist down. So I'm gonna get my traction, at least 3 different places there. And since this is such a small vein, you want to go at a very shallow angle so that you don't go through it. Ready? 1, 2, 3, poke.
So for those who are viewing this, yes, it was more painful than the other one.
Yes.
As he moves it in, a lot sharper than the other one. The other one I could.
So I see my flash fill,
Mm-hmm.
and then start to thread.
And that hurt a lot.
That hurts a lot. I'm
That
sorry.
probably means that it started going through.
It's got my flash again filling up that chamber.
It's filling
So
up
let's
a lot
try.
better. And
Still
resistance.
won't thread. You okay, Doc?
But remember, guys, we're doing this on purpose, picking up a hard vessel just to see, because this is what we're faced with when we have a difficult IV. Sometimes that felt better.
Yeah. For some reason it wouldn't let me thread that all the way. There it goes.
So once he's in, he has some time to kind of calm down, do the same thing. We're putting that gauze underneath, get the flush and all that kind of stuff ready.
Yeah, so with these small catheter gauges, sometimes I will pre-flush these just because it's hard to draw blood back through these. So
Good point.
Little gauges have a hard time drawing back. Pressure. flowing.
Yeah. Definitely a lot slower, but it's a much smaller catheter. I can tell you, I mean, these AC, I can't even feel it. This one, even just being there, I can feel the pain. And if it fills with fluid around it, then we're not in. Is it going in?
Slowly. I've got a lot of resistance. And like I said, there was that bifurcation right there where that catheter tip's probably sitting. And I pull back. And you can see I've put in about a mil there.
And if it was super Q, you would start seeing some
Bubbles.
boiling
up.
Swelling.
And sometimes IVs will be positional inside, whether the tip of the catheter is sitting on the end of a valve, sitting at a bifurcation, and a little pulling back, just a little bit, a millimeter or two, will kind of release that off the edge of the valve, or the tip of the catheter being on the side of the vein or something to that degree. And you'll get a little bit better of a flow. So I got about 4 mLs in there. It
didn't bubble up.
Doesn't
didn't
look like
swell
it.
up.
But these 24 gauges are last resort kind of deal, or for babies. So
Some patients, we get them on their thumbs, in between their digits, tiny little vessels, and this is all we can get in. Again, just for medications, you can't really flush a lot of fluids through them. How about that? 2 IVs. Now it's gonna hurt the most, taking the stickers out.
Yeah. Sorry, you get a free wax job with that.
All right. Now we gotta go and do a lumbar puncture on a patient, but I'll take this out first.
2, 3 pull. Yeah, that's not fun.
That one hurt the most.
Yeah.
All right, Tyler, thank you so much. And we'll see you in the next video. Send comment suggestions and no, I already did the EJ. Just find the video. Thank you very much for watching, and for other videos go to www.drer.tv.